we've got the lifting of restrictions on alcohol sales is a relief to many, so mostly because of livelihoods that were at stake in the industry. But Australian National University research fellow Yandisa Ngangashe says the regulations present valuable lessons for alcohol regulation more generally. She's written about this on the Conversations website and joins me now from Canberra, Australia. Thank you so much, Ayandisa, for your time this morning. I mean, when we're looking at just almost the two parallels between having a state where alcohol is easily available and readily available, as we saw before COVID-19, to now where we've got intermittent restrictions that are being imposed, what has been your observation regarding, the impact of such?
My observation has been that the restrictions of alcohol sales have done really well in terms of reducing patient loads in hospitals, and this is well published in a lot of studies and in a lot of hospitals where they counted and they compared cases before and after the alcohol was lifted.
But in that case, then, where do you balance between livelihoods, which the alcohol industry relies significantly on, versus, the hospitals as well as emergency services that need to be perhaps reserved for those critical patients and not necessarily for alcohol-related accidents and incidences?
Yeah, banning alcohol is not sustainable. It's not something that can be done permanently. What is needed is sustainable policies that can reduce, that can help with reduction of our drinking problem as a country. So we can have restrictions in advertising of alcohol so that people drink less. We can have more policing on our roads such that people are complying to the law so that there's less drunk driving. So there's a lot of sustainable policies that can be implemented. So as much as that this alcohol regulations showed us, okay, this is what it would look like if we drank less, but they are not sustainable. We need proper policies that have been tried and tested in other countries that can help solve the problem in the long term.
I mean, you're speaking here about sustainable policies. Many would argue and say, listen, it doesn't matter if you restrict alcohol advertising. It does not change the mindset of a South African from going into a bottle store or going into whichever establishment and purchasing their alcohol beverage, right? So then in that instance, what needs to be also considered besides just banning the advertising or restricting advertising, besides, enforcing law enforcement? Can we not also look at the psychological impact and the psychological relationship which South Africans have with the booze?
Yes, definitely. So you cannot just implement one policy. So the restrictions of advertising would form part of larger interventions. So you'd have interventions at community level where you are helping individuals, you're helping communities, and then at the same time you have interventions at policy level, and then you have interventions at retail level. So you need multi-pronged interventions at all levels of society. So it can't just be one intervention. It can't just be advertising. It can't just be banning alcohol. You need all these interventions happening at different levels of our society.
Yeah. And so could we not then use this COVID-19 pandemic to ease South Africans into a new normal of restricted alcohol consumption or even restricted alcohol advertising, so as to free up bed space, for lack of a better term, so you do not find emergency wards absolutely flooded with patients, particularly during Friday, Saturday and Sunday, over alcohol-related, as I said, accidents, incidents, fights, violent outbreaks and the likes. So can we not use this as almost like a landing board for the future for alcohol use in South Africa?
Yeah, that's what I think we could do, or that's what I think we should have done. But like I said in the article, that there has been this lack of nuance, that it's been very much for or against alcohol. It's been very much who's against alcohol restrictions and who's for alcohol restrictions. It hasn't been a nuanced conversation on what are we learning from here, what can we do to go forward. So there's that little voice has been lacking, and I think yes, this is the time for us to actually talk and to use this lessons from these alcohol policies that we have. This is what we've learned, and going forward, this is what we must do, or that this is beneficial. This is what happens when we drink less, and how can we use this to build momentum for future policies. So it's definitely lessons, but I think there's still like a missing gap. I don't think we will use them, or we are using them enough. I mean, there's still opportunities. The COVID is still going on, so there are still opportunities to learn and to use the information.
But is there political will to implement certain sustainable policies? It's one thing for government to be implementing during a COVID-19 pandemic. It's a different thing to be enforcing some of these policies should or after the COVID-19 pandemic. And are the politicians even willing?
That's a very interesting question. I think the politicians are willing. But then we need to get momentum. We need a strong pro-public health voice, because there's a very strong industry lobby that will bring up the jobs, that will bring up the economy. So we need a stronger public health voice in support of the government. So in policy theory, this is what is called a policy window. It's demonstration that right now we can go either way. We can use this to build and implement more policies, or it can just also mean nothing. And this is an opportunity for civil society to stand up. This is an opportunity for public health to stand up. This is an opportunity for ministers that are pro-public health, ministers that know the impacts of alcohol on road accidents and on crime. Those ministers need to stand up and speak in one voice instead of everyone pulling to their own direction.
Yeah.
So I think, yeah.
Is there a role that the media can play in that regard, in being able to formulate a cohesive, a positive conversation around alcohol consumption in the country, around livelihoods that will be affected by potential restricted policy, and around the implementation strategy thereof? Because sometimes it would seem that the media takes, different polarized sides and almost shows the different polarized sides instead of fostering a conversation amongst the value chain.
Definitely, the media have a role to play. One of the ways they can play a role is by bringing in less polarized voices. So because media is crucial for getting public support behind policies. So we need more public health oriented voices in media, because right now in the study that we did, we found that there's a lot of industry representation, and there's also like a lot of government, but then hardly anything from the public health voice. So the media can play a role in giving more pro-public health voice and allowing more nuanced ideas to make it to platforms.
We'll leave it there for this morning. Thank you very much for your time. Yandisa Ngqangqashe from the Australian National University, just giving us just insights in terms of exactly what does COVID-19 present in terms of just policy, to think about different policies that we can implement in the future. There, she was giving us the latest regarding that.